Today we're gonna do the pulp calcification that started Bismillahirrahmanirrahim. Acha. Okay, so we're gonna do the, basically what is actually pulp calcification. The pulp within the tooth, it basically calcify, and basically there's a frequent finding in teeth. Okay, so basically the pulp of the tooth is basically has a discrete calcification. Then there are two types of pulp calcifications. Either it's pulp stones or denticles or diffuse linear calcification. Moving towards words. Pulp calcification is a frequent finding. You will frequently find that the pulp is calcified. Okay. In 10 to 20 years age, it is 66% and 90% in 50 to 70-year patient. Okay. You can see even in this X-ray that the pulp is calcified. Possible ethologies, which is very important. Okay. Associated factors. Tooth might have aging is one of the factor. Then atresion, abrasion, and erosion. Okay. Okay. But actually they okay are not the cause for calcification. They are associated factors. No, very important. Dentine dysplasia, Ehlers-Danlos syndrome. It occurs in that also, basically the pulp calcification. Then you have pulp calcification. Either it is in linear or either it is in pulp stones. Okay, so very important here. So as we talk about before, there are two types of calcification, either pulp stones or we have a diffuse linear calcification. Pulp stones, in pulp stones there are basically localized masses in the coronal or radical pulp, or either there is a linear strand of calcification commonly in radicular pulp. Okay, moving towards forward. Now pulp stones. Pulp stones are basically are classified bodies, very important. They have organic matrix, and basically they are occur in the coronal region of the pulp. They have two types, true pulp or false pulp. The true pulp stones contain tubules. The tubules are known as albeit scanty or irregular and have an outer layer of predentine and adjacent odontoblast. False pulps are composed of concentric layers of the calcified material with no tubular structure. Means that the true pulp has the tubular structure, but the false pulp does not have the tubular structure. Okay, this is the true pulp, but the false pulp does not have any tubules. Okay, it is classified on the microscopic structure. Okay. Okay, pulp stones are formed within the coronal portions of the pulp. Okay, means they are coronally formed, and they are basically either related with the age or local pathogenesis that developed. Most pulp stones basically developed after the tooth formation is completed and are usually free or attached. Means mostly if you will find it that the pulp stones either are free or attached. It basically occurs after that the tooth formation has the tooth formation is occur. Okay, you can see it, the pulp stones. Okay, histopathology of the false pulp stones. Pulp stones demonstrate a central amorphous mass. So basically there is an as we saw it that it has a centrally amorphous irregular mass of irregular calcification. Means they have irregular calcification which is surrounded by the concentric laminar rings of regular calcified material. Means if you consider it, so basically what we have laminar rings of regular calcified material. Means it is a concentrate laminar rings of a regular calcified. Means they have rings that are regularly calcified material. In that you have a centrally amorphous irregular calcification mass. You have pulp stones are thought to develop around the central nadir of the pulp tissue. Collagen fibri या ground or necrotic cell, मतलब it occurs basically during cell necrotic cell remnants. Initial calcification begins around the central nadir and extends outward in a concentrated, yeah, radial pattern. It basically grows in a radial pattern. Okay. Regular radial pattern of the regular calcified media. So very important. Basically, the histology that it has basically a concentrated laminar rings of regular calcified material. In that, we have an amorphous mass of the irregular calcified material. So basically, we have the a false denticle, means we have a false pulp stone here. Basically, it is actually larger than the true. It is basically okay. Now moving towards the true pulp. Structures resembling the dentine. Yes, they resemble the dentine because they have dentinal tubules, but the false pulp does not have dentinal tubules, and it has also the odontoblast. They also resemble secondary dentine. Secondary dentine cells tubules are fewer and irregular in number. They have the tubules are few, they are less and irregular in number. Okay, so this is the true, often seen in coronal part. Okay, so basically what happened that often seen in dentinal tubules, okay, irregularly, and then resemble the secondary dentine. Okay, then pathogenesis, very very important.